So can you just remind me briefly how much you've done, what you've done so far in terms of treatment?
Okay, I'm not sure how much background you had about myself.
At all.
I've just turned 43 and I'm just trying to plan for a pregnancy. In the past I left trying for a child quite late in life. I've had all the tests done, everything checked out. They've said it's unexplained infertility. They cannot find anything wrong. I've had a couple of miscarriages a couple of years ago.
At what time, what stage?
One was about 7-8 weeks, and then straight after that was another one, which was probably about 3 weeks. So again, the consultant said, well, you know, yes, you should be able to conceive, but as such, I haven't. I've had a couple of rounds of IVF, and I've had three rounds of IVF. Every single round of IVF, they have managed to produce a massive amount of eggs, you know, sort of 19 follicles each time. So,
if you don't mind, I'll just
yes.
stop you so I can explain to them.
Oh, yeah, sorry.
So we have 3 IVFs with a lot of eggs. Should I mark it? What do I mark it?
Down at the bottom.
Let's say 1 egg for each IVF, and we have a lot of eggs, and what does that mean?
We should mark that's 19 follicles each time.
Yes.
Huh?
We should mark miscarriage.
No, but what does it mean? A lot of eggs for us.
He's releasing a lot of eggs when he shouldn't.
Same place.
So who doesn't see anything?
More
It's
cross.
a lot of spirit bleeding.
Fortunately, with the IVF treatment, fortunately I had a lot of eggs were produced. My partner's sperm was satisfactory, and I had about 50 to 60%, about 50%, sorry, fertilization rate. On every single occasion, between 2 and 3 embryos were implanted. Unfortunately, none of them took, apart from my very last cycle where I had so many embryos left. I froze some, and on my last cycle, one of the frozen embryos actually took, and I became pregnant about 2 months ago. And the hospital I was using had never ever seen it before for a 42-year-old, 43-year-old getting pregnant with a frozen embryo transfer. They said it never happened before. Unfortunately, it didn't work. But the last cycle I had...
First of all, this happened in my clinic many times.
Yeah.
So your hospital must be a very small time.
It is.
Yeah.
Very small.
But why would it happen? And it happens a lot with older patients. But the frozen cycle works, the fresh doesn't. According to Western medicine, it's counterintuitive. The fresh is always better, frozen is less. For a different reason, it's true. But why would some frozen cycle would work? I mean, the success rate is less because of low thawing rate. That's why the success rate is great. So many don't make it. But from the ones who make it, there's actually a better success rate with the frozen than the fresh. And why would that?
Less stimulation.
There is no stimulation
Yeah.
during the frozen cycle. What happened in stimulation?
It bleeds.
Trying to show in.
Right, it bleeds is showing in. Frozen cycle, no problem. I mean, just put a name. That's why.
I don't know whether my treatments, all the treatments were the same. I used the same drugs, same simulation, everything was the same. Except on the second round of IVF, I think Alex can inform you, I probably had a week or 2 of some drugs and Chinese herbs to try and get my health back, on top
grams
form.
of Sinifar just to try and, because there's a history of a week showing cold hands, feet, lots of cold body. We were using 80 grams just a couple of weeks before any IVF to try and make a difference last few cycles.
And my last IVF cycle, we spent a little, because I'm obviously panicking because of my age.
Yeah.
So I put pressure on Alex, saying, well look, I can give you a bit more time on the last cycle. I think we had a couple of weeks, or probably
2 or 3 weeks.
a bit more. So I don't know whether that has anything to do with that, one of my embryos was particularly strong, it implanted. I don't know. So I've come back to see Alex, and we're going to have, so I'm going to have another go, but I haven't actually booked it in yet.
There's anxiety of the window closing because everyone's saying this, but also you are starting to go actually.
I'm panicking,
Give myself some time.
And I know the time is ticking. Although I know that I've got plenty of eggs, but age.
Yeah, when somebody says you've got 3 months to live, you've got cancer, it's terrifying. It's a shock every time. And shock you, and it's like, no wonder how long you keep going.
Yeah, I think it's the same with having a child.
That's what I mean.
Yeah, it's not good.
Doctors are strong characters, you know.
But if I ask some questions, then at the end we'll talk about the health question.
Okay, so anything else about your health, like say body temperature or?
Generally, I would say that I was in good health. I've never had any diseases, never any problems. I always feel fit and healthy. I've always got cold hands and feet, and we started to address that. Always have.
So where is that?
Are they still as cold? They still get cold, or not as cold? They're still cool.
It's still a bit chilly, but I have to wear socks most of the time, even in
Better
the summer.
circulation.
Circulate, I would say, but it's always been a problem. But apart from that,
What about periods then?
my menstrual cycle is regular. 30, 31 days. Always has been, but it's got progressively lighter, a lot lighter. And I only noticed any difference when we started going on to the herbs. It did actually, it did seem to improve, or was a bit longer.
It was 1 or 2 days, wasn't it? It's got a little bit longer.
If you're lucky, yeah.
Julian.
Is there any pain before, during, after?
Yes, sorry, and the day of, or day before, quite a lot of pain.
It's plus first day. Once it's flowing, it's
It's
easy.
okay.
Digestion, appetite, things like that.
Good appetite, any bloating, any nausea, heartburn, or
No,
good appetite,
pretty good. Too good.
too good. If you don't eat, give you a week at all, or shake you, or?
No, just a bit sick, but otherwise no.
Oh, sick, if you don't eat, like, how do you feel?
How can I describe it?
Nauseous?
A little bit nauseous.
What does that tell us? Where is it, first of all?
That means be a week.
Is it
Slow.
but like severity-wise, 1 to 10? Severity-wise, 10 being the most severe, young mean problem. This kind of situations feel a little nauseous if she's
It's fine.
just a little bit, but there is something though, definitely, okay? We're already building the formula. What bowel movements?
And in terms of loose stools, constipation, slowness, or
No, I would say that the stools are average.
7 out of 7, or
Yes,
I guess a daily
every day,
balance.
yeah. Although after the last herbs, it was quite loose.
Urination? Is urination frequent or frequent?
Well, frequent. In fact, I would say that I go more than I would say an average person probably does.
Is that every hour or so, or
I mean, every couple of hours.
so 5, 6 times a day?
Oh,
Maybe a bit more.
easy.
Do you have to get nice at all?
I used to. What am I saying? It's not so bad now.
Sorry, what did you ask them?
They need nighttime urination.
Alright.
Any pains, back pains, headaches, knee pains?
No, I'm
Do you ever get dizzy, lightheaded?
no. Sorry, I haven't got any symptoms to
And
give
sleep,
you.
your sleep is good?
Yeah, sleep.
No dreaming, no heat at night,
I'm
cold.
quite. Well, my feet are cold, but I get quite hot. Sorry about this, it's
That's good.
very odd.
That's what we're trying to do, trying to nail these little things that actually give us a bit more definition.
When you say feel quite hot, is this like all the time or just periods of feeling hot?
Oh, it just at night time. I think it's been lately as well, it's so warm. I think I'm just...
Did it start after the IVF or before?
That's a good question. I mean, I've probably noticed it more since I've had IVF. Yeah, probably.
Where did I put it?
So you sweating?
Show you.
I did go
Why
one
did
stage.
you
I
feel
think.
hot at
Yeah.
night
The sweat.
after the
Yeah, it's
IVF?
not as bad now, but I did.
There was some sweating as well.
Less unification now than before. She's yeah.
Less medication.
Yeah.
Okay. And every time you got 20 eggs, every cycle you got 20 eggs, you said?
Between 18 and 19 eggs, yes.
And both of them have fertilized and both?
Yes.
That's pretty good. And did they tell you also different grades? They were good grades, different grades?
I had ranging from, the last ones were the best. The last cycle was the best graded ones, grade 1 and grade 2s. And then it froze a grade 2 and a grade 3. And then as they were freezing the grade 2, on thawing it became a grade 1. As we
Pretty
think.
good. Now, during the IVF or right after, did you have any side effects or felt pretty good?
Oh, I was okay apart from after the egg collection, that was quite painful.
Just from the retrieval?
Yeah,
right?
for about a week.
But during the stimulation, suppression, you felt okay?
I was okay.
So what does that translate to us? What else do you have here? So what is your plan? You have a plan like to do another cycle?
Yes,
or what?
in possibly next couple of months.
Okay.
You know, or certainly will be now,
You
August.
speak about it before?
Yeah, well, we've had kind of sometimes 1 week to almost 3 weeks before each of these processes to try and get some signify in there. It does seem to make a difference. We've got kind of possibly 2 months now. So it's a small window, but it's also a lot more than we've had before.
Right, is this something covered by the insurance or is out of pocket kind of?
It's all out of pocket.
And the doctor told you that you're running out of time kind of a thing?
Yes, they told me to question redoing any IVF. It's a lot of money, and for my age group, they're saying it's practically 0 success rate.
And you have a lot of money? Nobody has a lot of money.
Nobody has a lot of money. It depends what you want to spend your money on and what you think is important.
Well, you know, I can share with you a little bit of my experience. It's the only thing I can do with a short visit that I have.
No, that's fine.
Because in my clinic I have a lot of experience with IVF. Also part of my doctoral program in Chinese medicine, I sat for 300 hours in an IVF clinic as a rotation, part of my program. And I treated no less than 1,000 IVF patients with Chinese medicine at the same time.
But what age group?
All the way from 29 to 48. And most of them is 39 to 46, that's the majority. Small group of younger patients. Most are your age and older. And the chances are difficult. It's not necessarily so easy, you know, the age and all the stories the doctor said. But my experience shows a little different, and I just want to share it with you. Otherwise, it's hard to find this information. You know, if you are just one patient on your own, and the doctor tells you something, and you have nothing else to compare it to except maybe some online stories, it's hard to assess it correctly. But for me, after seeing so many stories, I have like a little bit different tool to assess what really is going on, what can we do, what can we change. So the situation is, from a Chinese medicine point of view, when you do IVF treatment, not the retrieval so much, but when you do this kind of stimulating drugs, it can result in a pregnancy. You get eggs, you fertilize, you put them back in. But as the doctor told you, the success rate is close to 0. And they didn't lie. It is close to 0. At least as far as they know. And the reality is, I mean, this is something that I asked myself a long time ago. If you do IVF, you put the sperm, you put the egg, there's an embryo developed, sometimes really good embryos. Sometimes patients have the money and they do PGD testing, genetic testing, whatever you want. They have eggs, embryos, this is the leading, the embryo. This will make it. And they don't get pregnant. So even though I believe them so much because it's so scientific and we know everything, at the end of the day, if there's like 98% failure rate, maybe they don't know something. That's what I thought a few years back. Otherwise, if they know everything, at least 50% cannot be 100% failure, and still they say, I know everything. It's just not logical. It's like patient will come to me, and I say, I know everything in medicine, whatever problem, I know everything about it, but everyone that comes, I fail. It just doesn't make a lot of sense. However, of course there are many patients who get with IVF, especially younger patients, but also some older patients, especially if they do donor egg. But right now we don't talk about donor egg, we want to succeed ourselves. My experience with Chinese medicine, with the IVF, without the IVF, showed me some other information that, all of a sudden helped me help a lot of couples. So in my office, my clinic, there are more than 220 babies conceived naturally with herbs, without IVF, and there's a few hundred more as they conceived with the herbs and the IVF too. But these patients I completely ignore. I'm just considering my own patients.
I mean, another possibility is that I would maybe like to try the Chinese herbs again, but going back to a drug, Clomid, which, rather than go down the IVF route, taking this drug which will help produce more eggs. And I think in the past, my partner's lived away, and I don't think we've actually taken the window of opportunity, or when the time was right, we missed the opportunity, so I think that's also been a problem.
It doesn't break. I mean, the real molecules don't break. They go into the blood, they cross the brain barrier into the pituitary gland. Pituitary gland is the hormonal gland that releases the FSH hormone. Now, there is what they call the biofeedback mechanism. The ovaries release estrogen that builds as the uterus lining, and as the estrogen increases in the blood, the pituitary gland in the brain has a receptor, estrogen receptors. So they start receiving more and more estrogen, and the more estrogen they receive, they know the uterus lining is growing, they start releasing the FSH to stimulate a follicle, so there will be an egg and pregnancy, etc. So what this drug is doing, it goes into the brain, then the molecule breaks, it attaches to the brain, to the pituitary gland, blocks the receptors, and then the estrogen rises in the body, and the pituitary glands can recognize it because all the receptors are blocked, meaning they're occupied. And you only take it for 5 days, the drugs. So while you take the drugs, it blocks it. And then you stop, and there's no more blockage to the pituitary gland. The pituitary gland then freaks out. All of a sudden, there's so much estrogen, there was nothing yesterday. It goes into a panic mode. And then it releases a lot of FSH, and then sometimes you get 2 or 3 follicles instead of 1. So it is true that you get more follicles on a physical, statistical level. Say, well, 3 is better than 1, which is true. It's just all of a sudden we get all kind of strange reactions. And I had many like this in my clinic too. One time a patient came to me, the right side of the shirt is all sweat, like profuse sweating just from the right side, which I've never seen in my life. I mean, I saw people that have sweating, have heavy sweating. I never seen someone sweat only on the right side. Like something weird that nobody knows what's going on. And another patient went into a mental collapse, went into mental institute. Many patients don't go through that, but
many do.
Yeah, some go into a really bad place. Other patients don't react negatively or seemingly don't. I'm just thinking about it. In Chinese medicine, what we really treasure is we like to be healthy. I mean, of course we like to get pregnant and all.
But the Chinese herbs can't make you produce more than 1 follicle, surely. At the end of the day, it's all coming from the brain that will make it.
Nor do they want.
No.
Because
I know it's artificial, but when you get to a stage when you're older, you will try nearly anything.
unless
And
it's, this is if you don't know the truth. Then that's what I'm trying to explain to you. Meaning if you don't know, oftentimes people do mistake that they want if they knew. This happens to me many, many times. When I speak to patients and they come to treatment and I explain to them very carefully what the things that I know, at the end what I hear back is just, I wish I knew before. Then it's already messed up. It doesn't matter if you know after. It is better to know before and then have like an educated choice. Not know after and be sorry. If you have an educated choice and you decided to go this way, it's fine. But it's always better to know before, not after. Like that's what I think.
No, that's fair enough.
You know? And this is my and I'm talking from experience, not from all kind of imagination.
No.
Experience means seeing thousands of patients, and that's experience. From a Chinese medicine point of view, you see patients decline. Meaning a woman that feels her often sweat on the right side, in a very weird kind of thing, is bad. Start having hot flashes is bad. Start having migraine is bad. Like you don't have to be a doctor for that.
No.
And the question is now, it's a very fundamental question. If you think that being healthy, let's put it that way, being healthy, everybody knows it's good. But the question, if you think that being not healthy, or having side effects, or feeling hot at night, or anything we think is not 100% right, could possibly have a negative impact on the success rate of you getting pregnant. So it's not just meant if I feel good or not. Because many of my patients, of course, if they get to age 40, 42, 43, and they go to the doctor, and the doctor tells them, hey, you're too old, it gets you in a panic mode. It's like, you know, and they said, and this is also very interesting, that after seeing so many patients, they actually say to everyone, if you're 35 or 30 or 29, either you're too old or your ovaries are too old or your egg are too old. It doesn't matter how old you are. And this is also doesn't make a whole lot of sense. How some, okay, I understand you're 42, you're too old. So how come a 37-year-old is too old? I thought you were too old. How come a 32-year-old is too old? All of this, so, and you don't know it because you're the only patient. But I saw 1,000, and out of them, 99% told me the doctor said they're too old, or their eggs were too old, or the ovaries were too old. Which for me is nonsensical. So this is the only thing I can share with you. I have no interest other than try to share with you my experience, and you go home and you do with it whatever you want. Chinese medicine say to create a new life takes a body, takes also what we call energy, or spirit, or whatever else you want to call it. Aside from the physical body, there's something else. So in other words, when you took a sperm and you put it in an egg, you have an embryo, but embryo is not a baby. Like many, many women found out they do transfer, embryo transfer. Millions and millions of them, that it didn't work. So the embryo on its own is not a baby. After they put it in, 2 weeks later, 3 weeks later, if it attaches, it starts having a heartbeat. At that point, it's starting to be embryo, fetus, and etc. Meaning something is happening in the body, not in this stage of the embryo, in the ditch, but rather after that. And I'm not sure if the doctor did, and I'm sure he didn't, but he can address this issue. Meaning not in the embryo stage, but rather what happens after.
Well, I've asked them, I said, look, because obviously I've got plenty of eggs, it's all fertilising okay, is there anything I can do here to help implant to stay there? What tests, what can you do? And they said, we've checked you all out, we've done everything, it's fine. You're too old. Huh?
That's right. And this happened to 220 of my patients who are having a baby today. They come to me after they failed the IVF, not before the IVF. Rarely I get patients coming to me before IVF. You know, my program is stupid. They have to take herbs for 6 months. The IVF is only 1 month. No one in his right mind is going to spend 6 months before they spend 1 month. But the question is why 220 patients that were told by their doctors that they can't have baby, they failed few IVFs, they only had 1 egg, they had many eggs that fertilized but it didn't take, they were unexpanded, endometriosis, whatever you want. So again, this is not like, do I believe Chinese medicine, do I don't believe Chinese medicine? This happened. And to the question about the doctor, can they do anything else? They can. I know they can. I've been there for 300 hours. Because with the kind of stuff we're talking about, they can. The reason that you said maybe the herbs help for the one embryo to take it is actually very much probably the cause. But the reason that it's not a pregnancy yet is it's just not long enough, not strong enough. So this is, without getting into much detail and explaining to a whole lot of theory in this, there is another department that the doctors don't know, even though the authority in the country and they have...
Well, the doctors around here are not interested, okay? They're not interested at all. All the hospitals I use, you can't even mention it. It's...
That's because of your age. As much as you say, look, brilliant failed, I don't want the grief, so best leave it.
They didn't even know I was taking it because they would have disagreed with it.
Other herbs.
Where I am in the United States is the same.
Mm.
But I'm not, that's why I'm talking to you and not to the doctor. I don't want the doctor to get healthy and get pregnant, I want you to.
So where do you think, where do I go from here?
Probably need 6 months of herbal treatment, that's it.
I'm not prepared to do 6 months because my time, I'm panicking over 6 months. I'm going to be becoming 43 and a half, 40, knocking on nearly 44. And I said to you, I'd like something quick. I know you can't answer it, but I want something more concentrated than that. 6 months.
You did more concentrate. 2 cycles of IVF is more concentrated. It just didn't work. But no, the truth is that I'm not selling you here anything.
No, I know.
But what I'm saying is like this. Truth, you can't change it and you can't want it. Whatever will work, not work. It's not even up to me or him or anybody. I can only share with you what happened in my experience. Like you do X and Y, possibly succeed. You do W, for sure not succeed. It's all down to that. That's all. It's not about what you want, what I want, how much you want. It's not about that really.
So you're saying in your experience it's taken you 6 months to alter somebody's health so that there's a better chance that they will...
Not for somebody. I'm talking specifically for your kind of a case. So if someone like 30-year-old, then maybe they need a month. It's not the same. It's like they need more help, it's 6 months. Sure, the more help have a case.
Yeah,
but I just want to talk to you just for 1 minute about the issue of age, and I'm running out of time, which the doctors often use. You're old, and everybody knows that I'm old. I'm 40, 42, 44, I'm too old. No time. Chinese medicine has a different view of it, and I just want to, if you don't mind, explain to you for 2 minutes.
No, I'm listening.
Just about this issue, about time. I'm running out of time. Because Chinese medicine, we research it very deeply. Just this one issue. Chinese medicine, when we say I'm out of time, not out of time, I'm old and this, we really have a different concept because, some people, they live to be 70, other people live to be 100, other people live to be 50. All of a sudden, there's an issue with time, right? Why don't we all live to be 70 or 90? The same is with fertility. Some women get pregnant when they're 47, like one of my patients. I had about 20 patients between 44 and 46, babies naturally, not with IVFs. They are 2 years older than me. Many others, 30 years old, didn't get pregnant with me too, so don't mistake like everybody. So I'm saying younger patients didn't get pregnant too. But older patients than you did get pregnant. Younger patients in my clinic didn't get pregnant. How is that possible? 44 can't get pregnant because she's too old, I understand. But how come 44-year-old get pregnant and a 35-year-old doesn't? All of a sudden we have a problem here. According to that logic, I'm old, I'm too old, I'm running out. So how come the 35-year-old didn't get pregnant while the 44-year-old did? What's different? I tell you what's different in my clinic. We call it health, but it's not health. This is what we call Shaoyin energy. Is stronger. So, and that's the reason why some live to be 70 or 90 or 100 or 50 or 40. What we need for the baby when the sperm and the egg unite together, aside from the physical body, the sperm and the egg, is also what we call the Shaoyin energy from the mother and father to bind together. If this energy is too weak, you just have a sperm and an egg, which is an embryo in a dish. It cannot develop a heartbeat, which equal what you just did in the past 2 cycles. if you have a stronger Shaoyin energy, which we can re-establish or at least improve with Chinese herbal treatment, even if you don't get pregnant on your own, if it is stronger with the IVF, will work or has better chance to work. And this happens in my clinic many times. Patients took herbs for 6 months or so, didn't get pregnant, did IVF again, and all of a sudden they did succeed. But before they failed, 1, 2, or 4, or 7 IVFs. And what's the reason? They got just 7 months older. How did they fail 4 IVFs and 7 months later they succeeded? According to this theory of with the age, it runs against you. And normally it's true. If you don't do any kind of treatment like ours, just wait another year, the Shaoyin does decline with the time. Let's say you had 40%, you didn't do anything, next year you have 30%, of course it declines. But the kind of treatment that we're doing is actually making it stronger, at least to a certain degree. There are no miracles. The only question is how much can we make it stronger? So just by metaphorical thing, if you have 20% now, and you get herbs for 6 months and you get 30%, you get a little healthier, but it doesn't cut it. Meaning, you need 60%. That's why people do herbal treatment and still not pregnant, still doesn't work. But if you are managing to do it and you get 60%, then you do get pregnant, even if you're 6 months old. It's as simple as that. So not to say it always works, there's no problem, we have magic in Chinese medicine, it's not about that. It's just there is part to a pregnancy, to a baby conception, aside from the physical, sperm and egg, that Western medicine ignore as of now. You know, if you ask a doctor, let's say a heart doctor, surgeon, cardiologist, what do you think about cardiology and heart surgery in the 1800s? What do you think he would say?
Well, I'd say it's pretty primitive.
That was like 100, 200 years ago. They didn't know what they were doing. They didn't have our anesthesia, our monitoring, this, that, right? Because the Western medicine does develop all the time, rapidly. It doesn't stop now. What do you think an IVF doctor 100 years down the road is going to say about today, IVF?
Well, he'd probably be quite shocked to start with.
He said he's going to say it's archaic. Why? Because at that time they already have energy, all kinds of things, cell energy, whatever, they don't know. Right now, it's not that I know it, Chinese medicine just talk about energy. The herbs aim to try to help it. When Western medicine will get there, their success rate in IVF will be 90%, not 1%. But I don't know if you have 100 years to wait.
So what bottom line is you're saying really that I need to improve my energy levels.
But this is not, we're not talking like alternative kind of medicine,
No.
hippie language. This is real medicine. The kind of medicine we practice is with super potent herbs. This is not carrots and bananas. The reason that you had success within 2 months, the egg was a little better implanted, it's not even like regular Chinese medicine kind of practice. The herbs that we're using are super potent. That's why the practitioner has to be on top of it all the time. That's why it works. In that respect, what I want to say is if you do this kind of work for 6 months, you don't lose 6 months.
No.
But rather you just made a year.
So I said, like, I only do another few weeks. I can't wait any longer.
But listen, I mean, I see many patients, and the only thing I want to do is not convince you to do Chinese medicine.
No.
It's right, I want to try to convince you really to do the right thing.
Yeah.
In my experience from seeing all these patients.
No, that's fair enough. I mean,
With the goal in mind to help you get pregnant. And getting to be 42, it is really difficult time. And oftentimes in my clinic is the same. I talk to patients and say, I have to do IVF, and I can't wait 6 months. It happens to me a lot. But if you did twice IVF and they fail, sometimes this is like kind of make a, I said, you know what, I did the fast one, but it's not working. And sometimes I get patients that come to me like after 3 years of IVF for the first time. Like it was fast, but after 3 years it's not fast enough. I had a patient who was 46 and she started IVF at 42. Did 7 and 8 IUIs and 7 IVFs, nothing works. And at 45 she said, can I try? You know. The problem with IVF is that they weaken the Shaoyin. So after 3 years that she wasted in double speed of using up the Shaoyin energy that I need, Not just that she wasted 3 years, it was 6 years equal of
Yeah.
energy that she wasted time. So I'm not saying it's bad, I just said it is definitely abused. The only thing that I can recommend to you is do whatever in your power as possible. First, if you could, to dodge it and get pregnant on your own. If it doesn't work, get as ready as possible so you take one shot and it works.
Yeah, I think that's good advice.
I mean, this is the good approach, and many patients really are afraid of losing time because they get the wrong information. They get it from the doctors who these days want to sell a lot of it. In the 1980s, they thought it's crazy, nobody's going to buy it. You know, and this is the problem. I have a lot of experience in that, and I'm not saying it's bad. Many patients that I have who got pregnant also just, you know, said, I want to do it, and this and that. Without even wanting to, they dodged it. They got pregnant, and what do you, let's say you want to prepare to do IVF in 6 months, and after 4 months, by good luck, by chance, you got pregnant. You still going to do the IVF?
Well, no, I wouldn't.
Of course not. Right? The goal is not to do the IVF, the goal is to get pregnant. And you know, so this is why, you know, when you do prepare yourself well, in your case it is difficult to get pregnant on your own, even though there is a chance. And you get really lucky to have dodged it. But if not, you do it, 6 months later you'll be in a better position than today.
And I think there's wise words. And thank you.
Alright, so how about if you tell me the formula today? So what are the herbs?
What is it? Alex the pulse?
舌感骚、圣碱、当归。
Just write a prescription, similar to what we've been doing.
Yeah.
Just in case, you know, to start going through everybody
I
I think, yeah, let's say even if you do 2 months,
Yeah.
but think about before whether,
上
if there's two, if that battery goes down on IVF, then it's even harder next time. So just,
Yeah.
yeah, that thing of stalling it,
半身
every extra month is worth so much in terms
Yeah.
of charging the battery.
No, he's happy to
Shisha, Nanshanja.
Yeah, I've got no problem saying, Jack, if you want Jack,
No, no,
saying, you know,
fine.
try that.
But if we find out that, I mean, no pregnancy, we get closer to it. And before the period, you said you have severe pain.
Yes.
You know, so in this formula, what we're going to add?
Shampoo.
Yeah, washing on, says on shampoo. The side effect of our treatment is that you feel better and better.
Excellent. And I mean, I will